Right now, somewhere in Australia, a GP is telling a patient that their joint pain is simply aging, that their cartilage is wearing out, that this is just what happens after 50, and that patient is going to walk out of that clinic, accept it, and spend the next decade in progressive pain, believing nothing could have been done. Here is what that GP did not say. In the majority of cases, joint destruction after 50 is not primarily caused by aging. It is caused by a specific daily habit that almost every Australian practices for 8 to 12 hours every single day. And the part that should genuinely stop you. The damage this habit causes to your cartilage, your synovial fluid, and your joint spacing is cumulative, silent, and by the time you feel it, it has already been happening for years. If you want medical facts explained in plain language, no drama, no beating around the bush, hit subscribe and tap like right now. It helps this channel reach more Australians who genuinely need this information. Before I tell you what that habit is, I need you to understand something fundamental about how your joints actually work. Because almost nobody explains this clearly, and without it, nothing else I say will make complete sense. Your joints, your knees, hips, shoulders, spine, are not solid structures. They are living systems. And like every living system in your body, they need a constant supply of nutrients to survive. But here is where joints are different from every other tissue in your body. Cartilage, the smooth, shock-absorbing tissue that sits between your bones, has no blood supply of its own. Zero. It cannot receive nutrients through blood vessels the way your muscles, organs, and skin do. Instead, cartilage gets every single nutrient it needs through a process called diffusion, from the synovial fluid that surrounds it inside the joint capsule. And here is the critical part. Synovial fluid only moves, only delivers those nutrients when the joint is loaded and moved through its range of motion. When you compress the joint and release it repeatedly, the fluid gets pumped in and out of the cartilage like a sponge being squeezed. Stop moving the joint. Hold it in one fixed position for hours, and the cartilage in that joint begins to starve, not metaphorically, literally. The cells deprived of nutrients begin to break down. The cartilage thins. The surface becomes rougher. The joint spacing narrows. That process has a name: osteoarthritis. And in millions of Australians, it is not primarily caused by age. It is caused by what I am about to tell you. The habit is sitting, specifically prolonged, uninterrupted sitting, for hours at a time, every single day. The average Australian adult sits for between 9 and 12 hours every day, at a desk, in a car, on the couch, at the kitchen table, in front of a screen. And during every one of those hours, the joints most affected, your knees, your hips, your lumbar spine, are held in a fixed, compressed position with almost zero synovial fluid movement. Here is what is happening inside your knee joint, specifically while you sit for 3 uninterrupted hours. In the first 20 to 30 minutes, synovial fluid circulation slows dramatically. Nutrient delivery to cartilage begins to reduce. By 60 minutes of uninterrupted sitting, the cartilage in the loaded zone of your knee, the area bearing the weight of compression, has received almost no nutrient exchange. The cells in that zone are operating on reserves. By 90 minutes, inflammatory markers in the synovial fluid begin to rise. The joint environment becomes subtly more acidic. Enzymes that break down cartilage tissue become more active. And this is not a one-time event. This is happening every single day, for years, for decades. The cumulative effect is exactly what shows up on your X-ray at 58 or 63, joint space narrowing, cartilage thinning, bone-on-bone changes, and your GP calls it age-related degeneration. There is a second layer of damage that sitting causes that most Australians never hear about: When your hips are bent at 90 degrees in a seated position for hours, the hip flexor muscles, the muscles that run from your lower spine across the front of your hip to your thigh, remain in a shortened, contracted position. Do this for enough hours every day, and those muscles adapt to their shortened state. They become tight. Chronically tight hip flexors then pull the pelvis forward into an anterior tilt, rotating it out of its neutral position. That pelvic tilt changes the load angle on your knees, increases compressive force on your lumbar discs, and shifts the mechanical stress on your hip joints, all simultaneously. Meaning, prolonged sitting does not just starve your cartilage, it mechanically misaligns the entire lower body load chain. Now here is where it gets more serious. Because sitting alone is destructive enough, but the majority of people compound that damage when they finally do move, by moving incorrectly. After hours of sitting, your hip flexors are tight, your glutes are inhibited, meaning the largest, most powerful muscles in your lower body have essentially switched off, and your lumbar spine has lost its natural curve. And then you stand up and walk, or climb stairs, or pick something up off the floor. With a body that is mechanically compromised from hours of static loading. Wrong movement pattern number 1, the knee cave. When your glutes are inhibited from prolonged sitting, your knees lose their primary stabilizer. When you walk, climb stairs, or stand from a chair, the knee collapses inward, what biomechanics specialists call valgus collapse. Every step with a caving knee places abnormal compressive force on the inner compartment of the knee joint. The medial cartilage in that zone wears asymmetrically, faster on one side than the other. This is why so many Australians over 50 develop medial knee osteoarthritis specifically, not lateral, not diffuse, medial, because of a movement pattern, not aging. Wrong movement pattern number 2. The forward lean when rising from a chair. Watch how most Australians over 50 stand up from a seated position. They pitch their entire torso forward, shift their weight onto their toes, and use momentum to get up, rather than leg strength. What this does biomechanically, it shifts the entire load of rising from the powerful posterior chain, glutes, hamstrings, to the knee joint and quadriceps tendon. The patellofemoral joint, the joint between your kneecap and your thigh bone, absorbs a force spike that can be 4 to 6 times your body weight in that forward position. Every time you stand up from a chair the wrong way, which for most people is 30 to 40 times per day, you are driving a force spike through your patellofemoral cartilage. Over months, over years. Wrong movement pattern number 3. Walking with a flattened lumbar spine. After prolonged sitting, the natural inward curve of the lower back, the lumbar lordosis, flattens, and most people walk, stand, and move for the rest of the day with that flattened spine. A flattened lumbar spine changes where compressive forces concentrate in your intervertebral discs, the shock-absorbing pads between your vertebrae. Instead of distributing load evenly, pressure concentrates on the posterior edges of the discs. Over time, this produces disc bulging, nerve root compression, and the chronic lower back and radiating leg pain that millions of Australians over 50 accept as inevitable. Now, why does all of this matter so much more after 50? 2 reasons. First, your cartilage repair capacity. Cartilage cells, called chondrocytes, have a limited ability to repair damage even under the best conditions. In your 20s and 30s, that repair capacity, while slow, is still meaningful. After 50, the rate of cartilage repair slows significantly, while the rate of breakdown, particularly under inflammatory conditions, accelerates. The same amount of joint stress that your body could partially recover from at 35 produces net cartilage loss at 55. The balance tips. And it tips permanently unless you change the inputs. Second reason, muscle loss. After 50, sarcopenia, the age-related loss of muscle mass, means the muscles that stabilize and protect your joints are progressively weaker. Weaker glutes mean less knee protection. Weaker quadriceps mean less shock absorption at the knee. Weaker core means less spinal stability. Muscle loss and joint damage feed each other in a cycle. Less muscle means more joint stress. More joint stress means more pain. More pain means less movement. Less movement means more muscle loss. How old are you right now? Drop it in the comments below. Because at 52, at 61, at 68, where you are in that cycle completely changes what your priority intervention should be. And I want to shape future content around exactly where this audience is. So here is exactly what to do starting today. Not next week, today. Action 1. The 30-minute rule. Never sit for more than 30 consecutive minutes without standing and moving for at least 2 minutes. This is not about going to the gym. It is not about a structured workout. It is about interrupting the cartilage starvation cycle before it completes. 2 minutes of walking, 2 minutes of standing and shifting your weight, 2 minutes of gentle joint movement. That is the minimum effective dose to restart synovial fluid circulation. Action 2. Fix your chair rise. Every single time you stand up from a chair, scoot to the edge of the seat, keep your spine upright, drive through your heels, and use your glutes to push yourself up, rather than pitching forward on momentum. This single change, applied 30 to 40 times per day, immediately reduces the patellofemoral force spike on every rise. It also begins to re-engage your inhibited glutes, which starts to restore knee stability over time. Action 3. Hip flexor release, daily, before you move. Every morning before you walk, climb stairs, or exercise, spend 90 seconds stretching your hip flexors. A tight hip flexor pulling your pelvis into anterior tilt is not a permanent state. It responds to consistent, targeted stretching. Within 2 to 3 weeks of daily hip flexor release, most people notice measurable improvement in lower back comfort and knee tracking during movement. Action 4. Ask your GP about a joint health baseline. If you are over 50 and have never had a specific assessment of your joint health, not just an X-ray when something hurts, but a proactive baseline, ask for one. Ask specifically about your hip and knee joint space, your lumbar disc condition, and your muscle mass index. In Australia, your GP can refer you for a DEXA scan through Medicare if it is clinically indicated. Catching joint space narrowing early, before the cartilage is significantly degraded, is the window where intervention actually changes the trajectory. Once the cartilage is gone, the conversation changes entirely. That window is worth finding while it is still open. Your joints are not wearing out. They are being starved. And they are being mechanically overloaded in ways that compound that starvation every single day. The habit causing the damage is not exotic. It is not rare. It is something almost every Australian reading this does for the majority of their waking hours. And the interventions that interrupt that damage are not expensive, not complicated, and do not require a gym membership or a physio. They require awareness and a decision to apply what you now know. Your cartilage cannot heal itself the way your skin or muscles can, which means the best time to protect it was 10 years ago. The second best time is right now. If this gave you something real, subscribe and tap like. It helps Dr. Elara Whitefield reach more Australians who need clear, honest medical information delivered in plain language. Share this with someone you care about. It could make a genuine difference to how they move through the next decade. Your joints have not given up on you. Do not give up on them.